Good afternoon. Since the beginning of the COVID-19 fight, Florida has worked very hard at protecting our seniors, expanding testing, and supporting our hospital workers and hospital system. Particularly with respect to seniors, we focused very critically on nursing homes and long-term care facilities. Early in March, I directed Jared Moskowitz to implement strict screening measures at all long-term care facilities. We had a few dozen cases in Florida, in the entire state at the time, and at a minimum, all these facilities have had to adhere to very strict screening requirements. That includes any persons showing or presenting signs or symptoms of a respiratory infection, including cough, fever, shortness of breath. It was prohibited from entering a facility. Any person who may have been in close contact with anyone infected with COVID-19 was prohibited from entering the facility. Any person who traveled internationally prohibited from entering a facility until 14 days after their return to the United States. Any person who traveled on a cruise ship prohibited from entering a facility until 14 days after their return to the United States. Anybody who has been in a community with confirmed community spread of COVID-19 is prohibited from entering a facility within 14 days of their presence in the community with community spread, and any person who resides in a community with confirmed community spread, as identified by the CDC, is prohibited. So that was from the very beginning, because we understood that COVID-19 presented significant risks to people who were elderly and with people who had underlying conditions. Right after that, I directed Director Moskowitz to prohibit visitation from all facilities. We couldn't be sure who was going in. It was a tough thing to do because a lot of the residents like to have visitors, but we felt it was the right thing to do for safety. We had about 125 cases at the time. We were one of the first states to do it, and acted earlier than many of the other states, such as New York and California, in terms of their caseload. And so basically you were in a situation where you had the staff that would have access and workers, and then obviously the residents. Throughout the whole time period, we messaged and advised all seniors, regardless of whether they're in a long-term care facility or not, anyone who was 65 and plus or with underlying health conditions, to stay home as much as possible and to avoid crowds. We also did a formal public health advisory to that effect in March, because ultimately, if you look at the way this affects different groups, there's a disproportionate impact on that community, so we wanted to do all we could do to make them safe. But beyond screening and suspending visitation, our approach to protecting seniors and residents in long-term care facilities falls into three main areas. First, we continue to conduct long-term care facility assessments. So the Florida Department of Health has developed 120 ambulance assessment teams to deploy preemptive measures to prevent the introduction of COVID-19 in the state's long-term care facilities. These teams completed assessments at almost 4,000 long-term care facilities to determine immediate unmet needs and to promote appropriate infection control practices. These assessment teams worked in conjunction with county health departments to address needs and identify facilities where opportunities for improvement existed. The Agency for Healthcare Administration is also in constant contact with facilities throughout the state to make sure we understand and can respond to their needs. ACA staff has made over 1,000 in-person visits and made over 5,000 phone calls to these facilities. Second, the Department of Health immediately sends rapid emergency support teams to facilities who have residents that have tested positive for COVID-19. The department's rapid emergency support teams, or REST teams, operate as the incident command structure for Florida's long-term care facility response. These teams ensure the residents of the long-term care facility are in a safe and secure environment to prevent the further spread of COVID-19. REST teams remain on scene to provide support while staff members are appropriately trained to provide clinical care for COVID-19 patients. This model has been identified by the Center for Disease Control as a best practice for other states to follow. The department's best REST strike team includes an infection preventionist, local county health department staff, regional staff from the Agency for Healthcare Administration, nursing staff, a Florida Infectious Disease Transportation Network team, and an advanced life support ambulance. These REST teams have responded to 93 long-term care facilities with COVID-19 positive patients. The third component is testing. While we have been early and aggressive by implementing screening protocols and prohibiting visitation, testing remains an effective tool to identify an outbreak early and to mitigate any spreading of the virus. I've previously directed the Department of Health to conduct sentinel surveillance in long-term care facilities where residents and staff of the facilities are voluntarily tested for COVID-19 even if they do not have any symptoms. To accomplish this directive, the Department of Health successfully trained 30 paramedics to perform specimen collection and used 12 advanced life support ambulances to randomly collect samples from long-term care facilities throughout the state. But today, we are raising the bar even further. I am directing the Florida National Guard to create more strike teams to significantly ramp up testing in long-term care facilities. They have already visited and tested, I believe, hundreds of residents in South Florida with the National Guard strike teams. We are going to expand that to have 10 teams of 4, and we'll probably expand it beyond there as long as we have enough equipment and PPE, and they will begin their mission in the counties that are being most affected by COVID-19, so primarily in Southeast Florida. They'll be taking samples from all willing individuals in each facility, both staff and residents. It's critical to identify people who test positive as early as possible, and this will help us do that. One of the things that we've learned is you can have someone come in the staff, you can do a temperature check, you can check for symptoms, but people do carry this virus without a fever, without being symptomatic. And so you need to have a strike team going in and aggressively testing to try to preempt that. And what we found in a lot of these long-term facilities is the spread is more significant amongst the staff. But it's not that they weren't following the protocols in some cases, they were. It's just somebody didn't show symptoms. And so doing strike teams, I think, will be good for the residents, but I also think it'll be good to identify this with staff so that the appropriate staff can be isolated and we can prevent an outbreak among staff at nursing home and long-term care facilities. So this is an important additional protection, an additional step, and I want to thank the Florida National Guard for responding very quickly when we asked them to do it. Further thing on testing, we've helped set up and run the state of Florida, the Florida National Guard, a number of drive-through testing sites throughout the state. One of the ones we did very early on was in conjunction with Memorial Healthcare in Broward County. So far, this has been in operation for between 3 and 4 weeks, I think, and they've conducted over 11,000 tests just in that one place. They actually having people from the National Guard throughout the country come by, look at the site, try to figure out what they're doing right, and it's really become a model for people nationwide. In fact, they had a 4-star general, Joseph Lengel, recently visited the site and said it was one of the most successful sites in the country. And I think that they've gotten their wait time down to, I believe, under 30 minutes. I think, Scott, I think under 30 minutes. And so they've really running an efficient operation, and that's been a big help to the people of Broward County. So we really appreciate everyone who's doing that. Of course, we have other sites throughout the state, and the National Guard has been tremendous in all their support. So some updates on kind of where we are as a state in terms of the state of Florida. You look at the case rates per 1,000 population. Looks like we're a little bit behind Texas and California. Now, of course, we have tested more per capita than both Texas and California, but that just gives you a sense of where we are vis-a-vis the rest of the country on positive test results, positive cases of COVID-19 in the state of Florida. The death rates in the state of Florida per 100,000 in population, again, Texas, California, Florida, then you have some of the other states that are fighting, pretty significant outbreaks. Obviously, New York, you see very, very significant death rates per 100,000. Here's the cases for the last 30 days. So if you go back in the middle of March, obviously you were seeing a trickle of cases. Now, part of that was there wasn't as widespread testing. As we get into the third or fourth week of March, the testing starts to ramp up. And so really, I would say from maybe that last week of March on, that's a pretty good baseline to look at. So you see kind of the trend. I think the 2nd of April was the highest, and then it's kind of been in a little bit of a plateau since then. So obviously we're going to watch that every day. The number of tests that are conducted have been a good clip. When these tests are done, obviously we have our health labs that do some. Most of the tests are being done by private labs. Sometimes those negative results come in late. We wish we could get them turned around quicker. So some of this may be a lag from when they actually tested. All right, let's see. There. Can we go to the next one? Oh. Testing, okay. So you see how the testing is ramped up at the beginning of the month. They were harder to come by. We were sending them to Atlanta, CDC. They eventually had state labs certified to do it, so we were doing it in 3 state labs, but in a state of 21.5 million people, just have 3 labs that can run through 100 or 200 test results a day was totally inadequate. So hospitals ramped up their labs. The private labs, and we've had contracts with them. They've done a lot. So you've seen how the testing has really increased a lot, particularly over the last 3 weeks. Sometimes the up and down a little bit is more just about when you're getting results, I think, to see, you go down, then back up, then down, then back up. The trend has been more testing, and we want to continue to do that. You look at the deaths by age in the state of Florida. Obviously, most of the fatalities are 65 and plus. We do not have any under 25. It doesn't mean it can't happen. I know people like to try to twist things. Of course, it can happen. But clearly, there's a higher risk for people as they get into older age groups. And then here's the death rate per 100,000 by age. So obviously, once you start getting into that 75, 85, becomes a much different situation than people in the younger age groups. So final update on just the hospitalizations. I think if you look throughout the state, it's been pretty flat over the last 7 days. In the last 8 hours, there's been a net reduction of 27 people hospitalized in the state of Florida. If you look at the hospitalizations, Broward, Miami-Dade, and Palm Beach, they represent about 30% of the state's population. They account for almost 65% of the hospitalizations statewide. If you look at places like Hillsborough, 59 people hospitalized, Orange 95, and Duval 61. Those have been flat or even declining, which is a good sign. And then Southeast Florida obviously has more. And one thing with the testing too, if you look at the tests per person in Florida, that is obviously important. But what I did is I actually looked at tests per person in Southeast Florida because that's where the biggest outbreak is. So you got about 6.5 million people in those 3 South Florida counties, Palm Beach, Broward, Miami-Dade. And if you look at the number of tests we've done, it ends up being about 1 test for every 85 residents of those 3 southeastern Florida counties. So that's a really strong ratio. I always reference South Korea was viewed as the gold standard of testing because they tested 1 in every 200 South Koreans. Well, here in Southeast Florida, that ratio has been strong. Part of that is because our efforts with Memorial Healthcare, some of the other drive-in sites. We have 2 drive-in sites we're supporting in Palm Beach County. We have the Memorial site in Broward, and then we're supporting 2, at least 2, actually more than 2 in Miami-Dade County. We've provided some supplies for some other sites as well. So the testing has been aggressive in Southeast Florida, and we're obviously going to continue to do that. In terms of available bed space statewide, we're looking at 42.5% of the licensed beds are available right now. I think I've cited at the beginning of March, a lot of the vacancies were about 12% statewide. Most of the beds were 85, 90, 91% filled in various markets throughout the state of Florida. So when you're talking about flattening the curve, the number one reason to do that was to make sure you had enough hospital capacity to be able to handle patients who would get infected and would need hospitalization. So we worked very hard to make sure that our hospital system would hold up over this period. Right now, the hospitalizations are basically flat. That's a good sign, but we look at it 1 hour at a time, 1 day at a time, and just keep trying to do the right thing. So I want to thank the folks we have here with us today. We're going to have Secretary Mayhew, Jared Moskowitz, and we're going to have Surgeon General and Secretary Mayhew. They're all going to just make a couple comments, give an update on where we're at, and then we'll be happy to take some questions. So why don't we start with the Surgeon General, go to Jared, and then go to Mary.
All right, thank you, Governor. First, our thoughts with all the families and individuals who have COVID-19, especially those who have lost loved ones to this virus. As the Governor mentioned, we've had a 5-point plan in the fight against COVID-19. First, social distancing. How do we reduce our risk for getting this virus? Testing expansion and contact tracing. This is a way we can stop person-to-person transmission. How are we protecting the elderly and the vulnerable members of our society? As we've heard, this virus is particularly harsh on the elderly. Preparing hospitals for the surge and protecting our healthcare workers. And also, how do we stop the introduction of this virus into our state? And also, most importantly, the introduction of this into nursing homes and other facilities. Where are we? As the Governor mentioned, we are essentially at a plateau with a slight increase in number of cases over the past week. The percent positive individuals testing positive for COVID-19 really for the past 10 days has been remained stable at about 11%. As the Governor mentioned, the number of individuals in the hospitals have remained stable over the past week with about 2,000 hospitalizations per day. And same for individuals in the intensive care units. We've been stable at about 800 individuals over the course of the state, 650 individuals on ventilators in intensive care units. This virus, again, is particularly harsh on the elderly. The elderly account for about 30% of hospitalizations, but about 60% of deaths. We are continuing to follow the trends very carefully. We are, as always, we are preparing for the worst, but hoping for the best. We need to continue to focus on the measures which can protect us all against COVID-19. Again, wish to emphasize the importance of avoiding crowds. 6-foot spacing. If we are going to be in gatherings, should be less than 10 individuals. We should all consider wearing a mask in public in the event that some of us are asymptomatic spreaders. Certainly do not work when we are sick. And again, for the elderly, these individuals need to avoid going out in public and certainly avoid contact with individuals who are ill. We are at a plateau situation, but cannot emphasize enough that we cannot let our guard down at this present time. Until we get a vaccine, which is a while off, this is going to be our new normal, and we need to adapt and protect ourselves. Thank you.
Great. Director Moskowitz.
Governor, thank you. So this disaster obviously has been unique, and in fact, it's the first time in U.S. history that all 50 states are under a disaster declaration simultaneously at the same time. And so obviously we're not just competing against the 50 states, we're competing against every country but Antarctica for that life-saving PPE. Thankfully, we've been able to turn the corner in a lot of ways. So to date, the division has sent out 6 million masks, 5 million gloves, 564,000 shoe covers, 515,000 face shields, 286,000 gowns, 77,000 containers of hand sanitizer, 47,000 goggles, and 22,000 Tyvek suits. And so we have millions of pieces of PPE on order that is now starting to come in, and we're going to continue to ramp up that operation all through the remainder of April, continuing into May, because PPE is going to continue to be that thing that we talk about for months to come. The division is still moving forward under the governor's direction to make sure that we have all those temporary facilities that we were working on, even though it looks like bed capacity, ventilator capacity, ICU capacity has trended in a much better direction for the state. We are still moving forward to have those facilities open. The convention center on the 20th of April, and the field hospitals in both Dade County and Broward County are already open. And so obviously we have those staffed at a minimal capacity, but have contracts in place that if we had to increase staffing, we could do that. We'll be looking more at surging staff into hospitals under their current surge plans. We're already working with a couple of hospitals now where we've given them some additional staff to meet their current load. We continue to follow the models that are out there. Here in Florida, we're very used to watching modeling, similar to a hurricane track that changes. The IHME model has changed on Florida 3 times already. First, our peak was May 4th, then it was going to be the 21st of April, now it's the 26th. Of April. And so we continue to watch that model as new data is gathered, and we'll continue to prepare accordingly. We are looking forward to, under the governor's direction, increasing testing in multiple areas. As we've alluded to, we're third in the country at testing, and we're looking to try to do that in some more disadvantaged communities going forward. As the Surgeon General said, we're going to continue to stay the course. The 30 days to stop the spread obviously goes until April 30th, and so those mitigation measures are working. The social distance measures are working. And so the Division of Emergency Management, we just want everyone to understand that now is not the time to change our behavior. Governor, thank you.
Secretary?
Thank you, Governor. I think it is interesting as we look at the 4 individuals here, what is often not appreciated are the hundreds and hundreds of individuals that comprise these multi-agency teams that have been working tirelessly under the governor's leadership, Director Moskowitz and the Surgeon General, to support this multi-pronged effort. And I'm going to speak to a part of that, but I think it's important to continue to underscore this has all been done as a multi-agency team response, well-coordinated, well-deployed. What I am so grateful for are the thousands of caregivers and nurses and direct care staff and physicians who have been on the front lines now for many weeks, serving their patients and their residents, caring for their colleagues, and supporting their communities. Around the state, hospitals have been pulling together regionally, sharing data, working collaboratively to develop an assessment of their region's capacity to respond to the worst possible peak. As Director Moskowitz said, we've seen multiple models and scenarios, and what I have been truly impressed by and grateful for has been the role of our hospitals in truly developing an assessment of their capacity, evaluating every bed, understanding how quickly they could bring staff on, and what is the true capacity, so that what the state's response is complementary of how the region is prepared to respond and care for any surge. And we have been well served in Florida because of the emergency status system that has been in place now for several years, where hospitals have been very disciplined in submitting their data to us so we know exactly what the occupancy is and have been able to track and trend that information. On the long-term care side, again, we've had so many calls over the many weeks supporting our skilled nursing facilities, our assisted living facilities, our intermediate care facilities, with both the directives to shut down to visitors, the guidance. I think we have said this from the beginning. Not only have we had, and the governor has had, laser beam focus on protecting our elderly, but we have acknowledged the high level of infection prevention that has been called for that is often beyond the PPE supplies that these facilities traditionally have. And so the state has worked collaboratively with these facilities, with the associations, to get those facilities prioritized for masks, for gowns, to support them. And then we have worked with our skilled nursing facilities, our assisted living facilities, on all the guidance to support their staff. But again, let's put a human face on this. We're talking about frail, elderly individuals or individuals with intellectual and developmental disabilities whose lives have been disrupted by this, who have been cut off from family and friends. And our facilities have bent over backwards to support creative ways to support that connection. I've seen photos of staff doing line dances down the hall 6 feet apart to keep their staff's spirit, their residents' spirits uplifted. So we have worked to support not only the clinical guidance, the adherence to infection prevention control, but to support the well-being and the mental health of so many of our residents, our patients, and the staff. As the governor mentioned, we have had well over 1,000 visits just from the Agency for Healthcare Administration, but when added to our partnership with the county health departments, EMS, we've had well over 4,000 visits. And we've had well over 5,000 calls to those facilities to talk through and work through a checklist related to infection prevention and control to make sure that we are a constant source of assistance and information. And then we have deployed teams who have been on site day and night, clinical staff supporting any facility that has needed that additional assistance. So incredibly pleased at where we are. We know that we must continue to be vigilant in our efforts to bend this curve and to support our most vulnerable populations. Thank you.
Can you just, we were talking about, I know you keep in close contact with all the folks in the various hospitals. What's their attitude now? Where was that maybe like a month ago? And I think, because I think that was instructive.
Thank you, Governor. And it is true from where we began with this and the work that the hospitals were doing. I've had the chance to speak almost daily with all the hospitals, and then more specifically to conduct regional calls with hospital executive leadership. And there is a level of confidence as they look at the data, their trends, and their preparedness. They are certainly not seeing the rate of increase, but they are confident in the level of preparedness that they have and believe that they are ready to address any surge that comes their way within the hospital. They are not seeing, or they do not have a level of concern that this is going to be well beyond the hospitals or health system's ability to manage effectively, which, by the way, Governor, is why I've also really stressed with our hospitals the importance of their regional assistance to skilled nursing facilities and assisted living facilities. It is our hospitals that have the infection prevention staff that can help to support some of the regional needs of these other smaller facilities to better manage and support those organizations.
Great. And then, Jared, can you just give an update on the latest in the supply chain? We're going to have an good announcement tomorrow about some more of the masks, which I think is exciting, and we've been working closely with the White House on that. But what where are we on just? I mean, I know there's been a crush. Where is it loosening up, and where is it still tight?
Yeah, Governor, we've seen a change in the marketplace over the last week and a half, 2 weeks, with your leadership, talking about some of the problems, getting those out there in the open. Obviously, the White House weighing in and fixing a lot of that. And so we've seen a lot of stuff readily available. So gloves, shoe covers, face shields, which is a one-off. So that's not something that has a daily burn rate. So you give out a face shield, that person, has the face shield. Gowns seem to be a significantly higher burn rate. We're seeing gowns, and there's no standardized procedure. So some hospitals are throwing away gowns after one wear or after one day, and so burn rates are different depending upon whatever protocols that hospital feels comfortable with. The same thing with goggles. We give out a goggle. It's something that can be cleaned. It's not something that has a daily burn rate. So we're doing much better than we were a couple of weeks ago when we kind of told everybody what was going on in the vendor marketplace. So vendors are delivering. We're getting regular deliveries now. Millions of this stuff is coming in on a weekly basis, and it's going out as fast as it can come in. N95 masks, we're even starting to see some change in that area, a little slower than some of these other categories. But we're using those to focus for our folks on the front lines, and using the N95 mask where it's needed. People are surrounded by other people with COVID-19.
Great. Mike?
Governor, this may be for you or Dr. Ripke, and it comes from my client in Jacksonville, but they're concerned that you're not releasing a county-by-county data on how many deaths are occurring in long-term care facilities, and it seems that you are naming some facilities but not others. What can you tell us about why?
Well, I'll let the Surgeon General opine on that. I mean, I would just say generally, Florida's data and website, there's more data put out daily basis by Florida's Department of Health than anywhere. People have commented to me across the country how good it is. So I appreciate what they're doing, and I'll let the Surgeon General address that specific question.
Yeah, thanks for your question. So within our Department of Health website, we have lots of information about county by county level in terms of zip code, and that includes the roll-up of the total individuals within that county who have lost their lives to COVID-19.
But with all this focus on keeping elderly safe, why not be more specific about specific facilities, at least within a county?
So again, first, within each facility, there are infection control measures which we have in place. We have teams which are going in there working with the hospitals, making sure they're doing all the proper procedures, making sure that we can support them the best we can. And so like any other individual in the community that loses their life to COVID-19, these are included in the roll-ups at the county level.
Well, what can't you say, however, which facilities have positive cases? Family members will be allowed to know that?
Family members are. So again, so if an individual has COVID-19 in a nursing home or a facility, we have contact tracing which is in place to make sure that the other individuals who've been in contact with that person are identified, and if they need to isolate, they're doing that. Same with staff members. So this is a situation where individuals are notified in terms of other family members if there's an individual with COVID-19 in that facility.
There still seems to be some confusion as to how you're determining which deaths you count in your count. I'm wondering if you can explain how you count deaths, and whether or not a Floridian outside of the state is counted, and whether or not non-residents who died in Florida are counted in those statistics.
Go ahead.
So we have two ways that we actually track both hospitalizations and loss of life. One is we get information from the hospitals through the ESS system, which the Secretary mentioned, and also within the Department of Health. If an individual is found to have COVID-19, this is a different process in place where we'll contact that individual. So slightly different ways how we collect the information, but they really are very close to each other.
And I think in terms of the fatalities, anyone who I think passes away with COVID is counted. So there's not like a causal determination, say, oh, well, you had COVID, but you really died from some other thing. Anyone who has it is considered a COVID death, correct?
Exactly. And to your question about the states, the way CDC has it, if somebody is a resident of a different state, as in Florida, and passes away in Florida, the CDC will actually count that death in the roll-up for the individual where the state of residence.
Governor, there's no...
Hold on, let's give someone else a chance. Anyone else over here?
Talk, if you could, about the expansion of testing. Contact with a positive test being tested. Is that playing into a long-term strategy here to eventually get the economy back on track?
I think it's good for health. I think it's good for economy, all that stuff. When you look at, so the 3 federal sites that expired on Friday, we came in, said we want to keep them going, Jacksonville, Orlando, and Hard Rock Stadium in Miami. And the thing was they had the feds limited 250 people a day through those sites, but we know we have capacity to do more. So we source the swabs, we have contracts with the private labs, and we talked to all the communities, and they were all very supportive of saying, yes, if you're 65 and up with symptoms, I mean, you are the #1 people we need to help, just given the statistics. But if anyone has coronavirus symptoms, we want them to go and get tested. And so now you're expanding it to anybody with symptoms. I mean, when we started this, the CDC said, the CDC made it sound like it was just anyone from Asia was really where it was. So were you in China? Did you have contact with someone in China? Now, we saw in Florida pretty soon, the cases were from Egypt. We had people, Dominican, I mean, really all over the place. So expanding that's important. So on those sites, if you're a first responder, healthcare worker, or you have coronavirus symptoms, regardless of age, you can go through drive-through. But if you're somebody with no symptoms at all, but you've had close repeated contact with somebody who is positive for COVID-19, we're providing an ability to get tested precisely for the reason that we don't know how many people are asymptomatic with it, and we don't know what percentage of the spreaders are asymptomatic. So this will really help us identify that. And then obviously if someone's asymptomatic but they're positive, we would want them to be self-isolated to prevent future more spread. We've ordered this FDA-approved antibody test. We're trying to get it shipped as quickly as possible. There's a lot going on there, particularly where it's made and everything. But the antibody test would also help us kind of on the back end identify, okay, how much has this really spread throughout the communities? And there have been different countries that have done different things. Stanford University is now doing one. I think they're going to come out with the results this week. But if I think we have between 500 and 600,000 positive cases in the United States right now total, probably closer to 600,000 because they're going up. But clearly, that's not the end result of everyone who's been infected with it. How many more? Is it twice as much? 3 times? 5 times? That antibody test will really give us an ability to identify that, which again I think is helpful for knowing where we are now and then going forward. But I would say, we showed the test figures go up. Once we started to hit a certain level of tests, we were in good shape to really spot these trends. You go from like March 1st to March 20th, well, a lot of that was just there wasn't as much testing than there was. Well, now that there's consistent testing, you can really see the trends in different parts of the state. And if you look in like a Duval County, 1 million people there, it's about 5% test positive and 95% test negative. You're in Miami-Dade County, they're not quite 20%. They had been pushing that, but they're pretty consistently about 18%. Some of these places like Michigan and Boston, they're 30, 35%. New York, 35, 40% of people that get tested test positive. So that gives you, I think, a good baseline to be able to think about, okay, how strongly is this spreading in different parts of the state? What parts of the state have it to where it's where it's not as rampant as there are in other parts of the country or even other parts of our state, and then you can go forward. I mean, I think that the data has just been very, very clear for us that you kind of have Southeast Florida and then the rest of the state. Not that it's uniform, the rest of the state, but it's definitely impacted those communities differently than Southeast Florida. I think they have 60% of the cases, at least 60% of the hospitalizations just in those 3 counties. And, they're big counties, but it's 30% of our state's population, but 60% of the cases and over 60% of the hospitalizations. Yes, sir.
Question over whether your moratorium on evictions extends to stay hotels and motels. It's the case out in Hillsborough where a couple of people were removed from the hotel, and they're saying that the executive order covers them. So I didn't know if there's any...
That's something I'm going to have to confer with. That's a good question. I mean, when I was doing that, I wasn't necessarily thinking of that. I was thinking more in terms of people paying rent. So let me look at that. I don't want to say yes, it does, and then turns out I just got to review it again. Yes, sir. Which system?
The unemployment system.
Yep.
When will the state get the money from the CARES Act, the $600 a week?
So I would need to talk to DEO about when exactly. We think it it's either, it's not supposed to be far out. I mean, so we may have some. If not, we're going to get some. I think we do have some now, or just got at the end of the week. And so these claims are being processed. We've had, oh man, I would say submitted claims. I mean, you're talking about hundreds of thousands. We've already exceeded, just in the last 3 weeks, the claims submitted than we had all of 2019, because I think we had about 300,000, 350,000 throughout all of 2019. So now you're able to submit. We have the PEGA website people can go. That's being migrated over into the Connect. You got to check the Social Security number. You got to do the verification, and then that will green light us to whatever federal money we can have, we can send out, and then obviously on the state side. So I've asked them to expedite that as much as possible. We've expedited, or we've expanded the call center so that, granted, yesterday was Easter Sunday, but I got the report this morning. The wait time was much less than it had been at the start of this, and so I told them just keep beefing it up as you need it, because I think it really helps if people just have a human being that they can talk to and get. And a lot of these folks have never applied for unemployment before. I mean, they've just basically been working, and you have this. So we want to do that there as well. But I've told them, work it really, really quickly and try to do it. But there is some verification that goes into it.
Regular unemployment checks going out already?
Yeah, there have been some that have gone out. Yeah, I mean, it's I don't want to give you a number. I reviewed them this morning, but there have been claims paid, and they are escalating in terms of the claims that have been paid. So we want to.
The department hasn't been able to answer that question, whether or not there have been, how many, and how much money has been dispersed.
Well, I've told the department that we all want more answers more quickly. So trust me, we want to get that. And but yeah. So I had the write up this morning. I don't want to quote a figure and then be wrong, but there have been claims paid, and there's a lot in the hopper right now, and people are working hard. And as you know, we've got a lot of hands on deck for this at this point, and that will, I think, really help us a lot. I got to go run and get on a couple calls, but we have these folks are going to be here if you guys have additional questions for any of the agency heads.
Dr. you mentioned, I can't remember if it was Governor, but you mentioned there's about 600 folks currently on ventilators. Do you know how many more we have availability, and their usage is also plateauing?
Yeah, thank you. You know, ACA sends through the ESS system. We collect reports on the numbers of ventilators that are available in the state. And at the present time, I believe about 7,000 ventilators are available.
And do we know if their usage is as the cases are?
Yeah, thank you. That's an important question. We have been stable for the past week.
We're seeing spikes in some rural communities like Jackson County, seeing spikes, Sewanee, which is a hospital, same thing with Bradford. What are the plans for either maybe Malvern or PM to handle, these are insignificant as like you're seeing Broward or State, that people are getting sick, there are a lot of,
Yeah, first, there's a lot of regional coordination. So right when this hit our radar screen, we had hospitals talk about making regional affiliations, make sure they'd be able to rely on sister hospitals. So we have that system in place, so if a hospital doesn't have capabilities, they can be transferred to another hospital in their region.
so if I get sick in Live Oak, I would go to North Florida, I would go down in Gainesville or Shannon.
Well, they actually, Live Oak, the hospitals there are caring for patients with COVID-19, but if the capabilities are beyond what they can deal with, then they will work with other hospitals.
You mentioned something that was important. You said, until we have a vaccine, this is the new normal. What do you mean by this is the new normal? Is this kind of shutdown right now? What are we talking about?
No, I mean, so when we have a vaccine against this, we'll be able to stop the spread of COVID from person to person. We don't have a vaccine at the present time. So our mitigation measure is the social distancing, 6 feet away from each other. I see some of you here wearing masks, have gatherings less than 10. I see some of the measures that are happening in stores. They have plexiglass sneeze shields. They are limiting individuals going into their establishments. So as long as we're going to have COVID in the environment, and this is a tough virus, we're going to have to practice these measures so that we are all protected.
Do you see obviously a vaccine could be the time frame we're looking at?
Yeah, based upon what has been reported, probably a year, if not longer, is what some individuals have talked about.
Are there any questions? Are there any questions for Secretary Mayhew? I know she's got to run, Secretary. Is there any questions for Secretary?
I do have one for her.
Okay, go ahead.
So
I was fine as it was going on.
sorry to keep you here. I have one question. It has to do with it. We saw today that Leon County now has the 4th highest number of residents or staff in a long-term care facility after Miami-Dade, Broward, and Palm Beach. Then you've got Leon. Then you've got even smaller Clay County and Suwannee County there. What do you tell us that accounts for these large increases in the smaller areas? We understand big urban communities are going to have more numbers, but Leon, Suwannee, is this some where it's going from staff to staff? Is it something that's happening, circulating throughout the community? What's the cause of this?
Well, and it will pertain to start to see cases in smaller facilities like assisted living or facility. And we are dealing with direct care staff who may be working multiple jobs because they need to feed their families. There will be a more aggressive effort to broadly test, why you may be seeing some of the numbers. And then we're also assessing that against what is the capacity in that area, and certainly in a rural area, the health system to respond. So we are deploying strike teams into those challenges that may exist when you have higher numbers of staff that are testing positive, because we've got to be working regionally, especially in rural areas, to respond, to be working with the hospitals and other organizations.
I mean, we've speculated and most of those are related to the Tallahassee Developmental Center.
There have been efforts here. So there have been efforts here, sorry about that, to, again, to respond quickly. There are some facilities that have a higher number of staff, and we are trying to focus as a region on that response, and again, with strike teams and staffing plans.
That makes it sound like you're doing more aggressive testing in these facilities. Is that what these strike teams are doing?
We are absolutely doing more aggressive testing, especially with staff, residents and staff.
You expect to test through the new strike teams.
I didn't hear the question.
About how many people more, in addition, do you expect to test to these new testing to the governor, strike teams the governor mentioned?
That I can't speak to. That is a Department of Health plan.
We'll be glad, if you just send us that question, Bobby, we'll be glad to answer that question for you.
Thank you.